Speak on medication administration, and I will be doing it on acetaminophen, or otherwise called Tylenol. The classifications are therapeutic. The adverse reaction and side effects are agitation, anxiety, headache, insomnia, dyspnea, and hypertension. The onset is zero point 0.5 to 1 hour, 3 to 8 hours. And at this time, I would check my facility policies, making sure it's okay for me to administer this medication. I would do first my hand hygiene, and my patient is Sid Garland. I would then get his chart, and I would look for the signature sheet, and I would sign my signature in Sid Garland's chart. So I would put my first name, Lysandra Swayze, my status, SPN1, which stands for Student Practical Nurse, and I'm in my first year. My signature, L. Swayze, my initial, LS, today's date, March 25th, 2020. I would then get a worksheet, and on my worksheet, I am now going to transfer from his chart some identification information like his name, which is Sid Garland, MRN number, the date of birth, which is November 8th, 1965, his allergies, which are penicillin and codeine. Also, I will put on my worksheet his past medical history, which is right knee amputation. Below knee, which is below knee amputation. He is 2 days post-op, and the reason for giving acetaminophen is mild post-op pain. At this time, I would look for the lab result, but in this case, I don't need a lab result to give acetaminophen. And then I would start the verification process. In this verification process, I would check the doctor's order and the MAR, and I would compare both the doctor's order and the MAR. So it's client Sid Garland, MRN number 344316, 344316, date of birth 11 of the 865, 11 of the 865, allergies codeine and penicillin, medication acetaminophen or Tylenol, dosage 650 milligrams, growth by mouth or by rectum, frequency every 6 hours, the hours are 6, 12, 18, 24, 6, 12, 18, 24. That's when it should be given, and it's now 600. I am checking my MAR for any special instructions given by the doctor. However, I see pain 4 days only. The pharmacy says does not exceed 4 grams per day. It was signed by the physician. I'm now going to put away my client's chart, and I'm going to do my hand sanitization, after which I would go, after putting away my client's chart, I would do my hand sanitization, go into his room to assess and make sure I am now giving him the medication to the right client and for the right reasons. After doing my hand sanitization, I'm now in my client's room. I would introduce myself to my client. After introduction, explain to the client, do my environmental check for his pain, ask him his pain score on a scale of 0 to 10. How bad is his pain? He said his pain score is 4 out of 10, with 10 being the worst and 0 being the least pain. So in this case, it's now okay for me to administer acetaminophen since his pain is 4 out of 10. I go back to the desk and I would take out from the drawer look in my client's drawer, who is my client Sid Garland. I would then take out his medication bottle, which is acetaminophen or Tylenol, and then compare it to my MAR. I would also check my 8 rights of medication administration. I would compare from the MAR to the bottle, which says acetaminophen. Sid Garland, since this is a stock drug, his name would not appear on the bottle. It is dosage 650 milligrams, that is 650 milligrams. It is to be administered by mouth and it's every 6 hours. At this point, I am now gonna do my second check. On my second check, again, I would compare the bottle with my MAR, acetaminophen or Tylenol, 650 milligrams every 6 hours, and it's supposed to be administered by mouth or by rectum. Again, it is supposed to be administered by mouth or by rectum, and it is 650 milligrams. After doing my second check, I would now do my calculations before giving my medication. My formula would be D over A times Q, and that is 650 milligrams over 325 and times the quantity. I'm going to do it on my calculator. So it's 650 divided, sorry, I said times the first time. It should be 650 divided by 325 times 1 equal 2. So my client Sid Garland should be getting 2 pills or 2 tablets. At this time, I'm going to put 2 tablets from the acetaminophen bottle in the lid. 1, 2. I have 2 tablets here. I would then transfer it to my cup. At this point, I would call my teacher to come and check my calculations, make sure I'm given the right amount of tablets, and I did my calculations properly, and it's okay for me to go in and check with my client. I would now do my hand sanitization again. After doing my hand sanitization, I would go into my client's room. When I go into my client's room, I'm now in the client's bedroom. I would now introduce myself to my client. My name is Lysandra Swayze. I'm a student nurse from Durham College, and I'm a first-year student. I am here to administer your acetaminophen to you, Tylenol, and is it okay? Consent given. I would do my environmental checks, checking that the suction is working, everything above the bed is working, the blood pressure machine working, bed is in its lowest position, call bell was in reach, bed rails were in the right position, and my client was found comfortable. At this point, I would then ask my client his name, his date of birth. I would then compare his MRN number from his armband to what I have on my worksheet, and they both compare. His MRN number is 34361. The same for the armband. Any allergies? He's allergic to penicillin and codeine. I would ask him what happens when he takes penicillin or codeine. He said he gets rash from penicillin and headaches. The same for codeine. Okay, now I have my 2 pills, and I'm going to give it to my patient. I do have a full glass of water, and I would educate my patient or do my teachings, letting him know he should always take the acetaminophen with a full glass of water. Before doing that, I will check to make sure my patient is not NPO and it's okay when he swallows. I am going to give him his 2 pills, which is 2 Tylenol. Upon giving it to him, I am going to stand back, see that he swallowed the 2 pills, ask him, how are you feeling? He said everything went down okay and he is fine. I would tell my patient if he has any rash or hives right after taking this medication, feel free to hit the call bell and I will be back to assist him. I will be back with him in 30 minutes to reassess if there is any hives or rashes on him, if he has any reaction to the acetaminophen which he took. At this point, I'm going to make sure the bed is left in its lowest position, call bell is within reach, it's clutter free, and sides rail are where they belong. I'm now gonna do my hand sanitization upon exiting the room. I'm now gonna go back to the chart to do my documentation. Back to the MAR to do my documentation. I am gonna do my documentation. I am gonna document the route, which was by mouth, as he had no problem swallowing and he was not NPO. I would also put the date and the time along with my initial and my co-sign nurse. I think I missed a few steps when I did my checks with the bottle and the MAR, my first and second check. I don't remember if I had said the expiry date of the bottle, which would be March 4th, 2023. So it's not expired on my second check, first and second check. Also, my third check, I should also make sure the medication I am administering is not expired. And after that, I never said I should always put my medication bottle back in the drawer. It should never be left on the counter or the table. I could leave the MAR as there's other clients who might need to look in the MAR. Thank you.